71% of breast cancer diagnosed under the age of 50 is detected by the patient herself. So why have they stopped recommending breast self-exams? What should you do to stay on top of your own breast health? I'm Cindy. I'm a certified and licensed genetic counselor, and I've been working with thousands of women who have a high risk for breast cancer for over 10 years. Some of the most common questions I get as a genetic counselor is, what should you be doing to watch the breast tissue, and what types of things should you report to your doctor? There have been some changes to the guidelines over the years. When I was growing up in college and in grad school, it was touted to do breast self-exams once a month and basically go through all the breast tissue, watch for any changes, and report them if there's anything noticed. However, the new recommendations are now suggesting that we are breast self-aware. What the heck does that mean? That is much more vague than the old shower card breast self-exams. Knowing what your breast should look like, how they feel, if there's any changes, what your normal is, what to report and what not to report is important. But do you need a systematic way to check this tissue, or is it okay just to go about your daily life, and if you notice anything in the daily life that's a little different, then report that? How do you know if your breast is changing if you're not checking them? There have been a lot of updated guidelines based on new evidence that has emerged over breast self-exams and whether or not they're really that useful. Everything from the American Cancer Society to the American College OBGYN and in between, a variety of different organizations have kind of pulled back from that systematic recommendation to say women should be aware of the breast tissue, what it normally feels like, and what it normally looks like, but may not need to do a monthly systematic check. So part of the issue here is always a balance between reporting things that are changing that might cause a woman anxiety, that might just be benign findings, versus trying to pick cancers up as early as possible and saving lives. And if you look online, you are going to see conflicting information out there from various health organizations. Some of them say you don't have to do anything. Some organizations are even teaching women how to do systematic breast exams on themselves with models that basically show women what a normal breast should feel like and when a lump is actually there that's concerning. So what approach are we supposed to take with this? The information out there is extremely confusing. Do this, don't do that. And if you're at a higher risk for breast cancer, it's nice to have something you feel you're proactive in, that you can do, that you can change, that you can report if something's changing. So of course, the main take home in all the recommendations is really to know yourself, know when things are different than what is your normal, and to make sure those types of things are reported. But how do you approach this is the big question. So a lot of this has to do with your personal comfort level on what you would like to do as far as how much to stay on top of things. My grandmother had breast cancer twice in her life. She picked up her second breast cancer herself in the time frame where we were taught to do self-exams of that tissue. So she was regularly doing it after her first breast cancer. She was checking herself monthly, and she did find her own second breast cancer in between mammograms. But what does the data say about this? Now, there was actually two primary large studies, one in Russia, one in China, that were looking at women who did systematic breast self-exams and compared them to the women who were not doing any self-exams. What they were doing is they're looking at a couple different outcomes. One of them was our ultimate goal, longevity. Do breast self-exams actually save lives? So the question there is not just do they get cancer, but does doing that systematic approach to a breast self-exam increase longevity, decrease mortality? So when they were looking at death rates from breast cancer in the women who are doing those self-exams and those who are not, they really did not see any difference there. So that is where our biggest take home for these guidelines has come from. It's basically they're looking at this and saying, doing this isn't really saving lives. And one thing they don't often mention when you're looking at the American Cancer Society guidelines or other guidelines, they'll reference the study, but they don't mention cancer detection rates. So does doing a breast self-exam increase breast cancer detection? Does it increase it at earlier stages? The data there has been a little bit more mixed. The Russian data actually suggests that doing the breast self-exams does increase breast cancer detection. Statistically significant numbers here. The Chinese information did not show that, so I'd say the question is still out on that piece. But you also have this data on, 50% of women who have breast cancer diagnosed after age 50 picked it up themselves. And for women diagnosed before age 50, it's over 70% picked it up themselves. So obviously does pick up breast cancer. It may not save lives. Is a few months earlier going to be the difference in lifespan? Maybe not, but could it make a difference on treatments given? I haven't really seen many numbers looking into that. If a breast cancer is detected at earlier stages, the treatments at earlier stages tend to be less complicated. So should we be doing this to try to reduce the number of treatments we need to give to a woman? Another thing we do need to look at, though, is some of the limitations of doing a breast self-exam. And what both of those large studies saw was an increase in number of biopsies in general, but more specifically, an increase in number of breast biopsies that were benign. So of course, everything's a balance when we're coming to any screening technology, and that is, does picking up breast cancer at earlier stages, even if it doesn't actually reduce mortality rates, is that worth doing a really systematic breast exam once a month? Or is that breast biopsy that keeps coming back benign, is that outweighing the benefits of picking it up early? So that's the big question. And really, when you look at these guidelines, it looks now like they are leaning towards those extra breast biopsies are causing a lot of anxiety for women and issues there. And I get that. Nobody wants to be poked all the time and biopsied all the time either for benign things. But is that worth doing that self-breast exam so that we can pick up the breast cancers earlier, even if we get biopsied a little more frequently? And another piece that they didn't actually look at is just extra imaging. If you're picking things up in between mammograms or breast MRIs and you're reporting that to your doctor, then they're often going to order more imaging between the times when you would normally do that. Now, the imaging might clear things. That happened for me. A month ago, I actually had something pop up. I tend to do breast self-exams fairly regularly, not militaristic about it, but beginning of each month, I like to try to check myself. And I had done that at the beginning of August, but couple weeks in, I noticed something flared up pretty quickly. It got to about the size of an acorn, so a couple centimeters, 2.5 centimeters, and pretty obvious change in my breast. Now, by the time I reported it to my doctor, which was the next day, and the doctor put the order in for diagnostic imaging, and I got that imaging done, there was a 3-week window before I actually got in to get the imaging done. By that point, things were actually shrinking back down. Now, being in the field I am, to me, that was reassurance that it's probably nothing. But being on the patient side and having a family history of breast cancer, I felt better going to get that imaging, even though I thought it was probably just a cyst knowing what I know. So I wasn't overly concerned, but yeah, I did add another image to what I wouldn't have otherwise gotten this year, and probably for nothing. In fact, I go in for the ultrasound of that area and they're like, oh, no, that's actually, you're right, it is just a cyst. It's now shrunken down to about 1 centimeter instead of 2.5 centimeters, about what I felt, at least my estimation. I might not have needed that ultrasound. Now, they were able to clear it with ultrasound. There was nothing questionable there. They didn't think I needed a biopsy. So I would not have counted towards that extra biopsy number that they got from those studies if I was in one of those studies. But on the other hand, it does raise that question when you feel these changes in our breast tissue. They change. most women, I should say, have lumpy breast tissue, but it can change through a cycle, it can change through a year, and many of those things are just benign things. So are we causing more anxiety than assistance by checking ourselves? So I get the guideline on pulling back from breast self-exams in one respect, especially for women at average risk. But for those of us with family histories who know we have a little higher risk for breast cancer, are we comfortable just going day to day, and if something comes up we notice, reporting it at that point, which is what they're recommending with the breast self-awareness rather than a self-exam. Anytime something changes, we should report it, but how closely should we be looking at that tissue, especially in women who are at higher risk? The difference in methodologies: breast self-awareness is definitely more relaxed. There's no need to do it one point of the month, time it with your period, or time it with the first of the month or your birth date in the month. It's more just day to day as you're getting dressed. Make sure you look at yourself in the mirror. Make sure you know what things feel like. So feel it every once in a while. Make sure nothing obvious is changing. And then, of course, to report anything that you're concerned about to your doctor and see if it needs to be checked out. But if you want to do a more systematic check, I was actually going to put this in a previous video, but it ended up being too much detail, too long in that video. So we'll slide it in here. This is how you do a breast self-exam if you want to be really systematic about it. Technically, all women should be aware of what their breasts normally feel like and look like. You may have gotten one of those shower curtains from your GYN at one point that shows, how to check your breast, what types of things to watch for. But I want to expand it a little bit beyond that, because it is more than just soaping up and seeing if you feel any lumps. First of all breast tissue is a little lumpy. So you are going to feel lumps. The question is, what is your normal? When you're feeling, you want to do it systematically so that you covered the entire breast tissue. Now, there's a few ways to do that. Some people start in circles, go in big circles. Make sure you get all the way up to your collarbone, all the way under your arm, all the way over your breastbone. Get all that tissue and then work your way in towards the nipple to see if there's anything going on there, anything that feels different. It will feel lumpy, but does anything feel like, a lot of people describe it as a frozen pea or something that's changing that just doesn't feel your normal? A lot of that lumpiness makes people nervous, but if you notice something that's obviously different from your norm, let your doctor know and they can check it out further. Next thing you also want to make sure you do is lift your arm, feel under your armpit, because the lymph nodes that drain all the toxins out of your breast tissue are under your arm. The main ones for your breast and your arm are under your arm. So you want to make sure that nothing's changing there as well. If you feel a lump in that area, same thing, report it to your doctor. In addition to feeling lumps, you want to make sure you look in the mirror. Looking in the mirror is important because you want to notice if there's any changes to coloration, anything that looks like a bug bite, anything that looks like a new dimple, or if the nipple is starting to pull in. Some people, by the way, have some of these features normally. If you're normal, you don't have to report it. But if it's new, you should let your doctor know right away so they can check it out and maybe get you some imaging. You want to make sure you get both breasts, arm up. A lot of the breast surgeons will actually suggest that you feel yourself when you're lying down. Also, that can help flatten things out a little bit, maybe get you a little closer to the chest wall as you're feeling things. Shower, mirror, lying down, arm up, and in circles. Or you can, the second way is actually going vertical from one side to the next through that same region, the breast tissue. Just do it systematically to ensure that you're feeling the entire breast tissue. When do you do this? It's hard sometimes to remember how often to do it. You don't want to do this once a week, twice a week. There's one thing with breast cancers. Most are not going to change enough in a week or two for you to feel a difference. For any of you guys with kids out there, you see a baby every day. You don't see their growth day to day, right? You see a baby once a month. You see a baby, if you're a grandparent, once or twice a year. You notice the obvious growth. So for breast tissue, it's kind of the same. If you're checking too frequently, you may not notice the changes. general recommendations are about once a month to check that tissue. And there's a lot of tricks to trying to remember this. You can either choose your birth date and on or about that date each month, check your breasts, or you could choose the first of the month on or about that date, check yourself. If you're not on that day, you don't have to give up. Just do it the next day. Just being aware of what things should feel and look like is important, so that you know if anything's changing in between imaging technologies. There are a few tricks. You could pick the first of the month, like I mentioned. You could pick your birth date, and on that date every month, go ahead with your breast self-exam. There is an app called Know Your Lemons, which actually goes through some of the things you need to watch for. It goes through some of the skin changes and lumps and dimples and things like that that you need to watch for in your breast tissue. So it's probably good for anybody to take a look at that information just so you know what to report. It's not just about lumps. It's about dimples, it's about skin color changes, it's about nipple retraction, that nipple pulling in if it's not your normal. But the app called Know Your Lemons also can give you a reminder on when to check yourself. So if you want to do a regular check once a month, if you want to time it with your cycle, it allows you to do that, and it'll send you reminders. So it is a nice, neat little app. Let me know if you've used Know Your Lemons or any of these apps, or have any suggestions in the comments below, because that could help others if they want to stay on top of this as well. So in the end, the choice is really yours. Either option, breast self-awareness, breast self-exam, they're both free. It's up to you to do it yourself and to report things that are changing. So how often you're checking yourself and how systematically is really more of a comfort level decision. If you're the type of person who wants to have a plan, to know when to check things, to be on top of knowing, yes, check it off, I did it this month, I'm good. That self breast exam, to have it, make sure you're getting all that breast tissue checked, feel free to do that. I'm not saying not to do it, but be aware there are limitations. Breast self-exams are actually nice if you're really wanting to have some sort of control, something you can do in between times when you're getting your imaging done. This also can be, different depending on your family history. If you've had women in your family pick up their own breast cancers by doing self-exams, I'm guessing you're probably going to be a little more on top of that versus those who have family members who've had breast cancer who never felt a thing, which was my sister, by the way. She never felt it, stage 4 breast cancer. She still couldn't feel it at that diagnosis. Not every breast cancer is going to be detected this way, but you need to decide on what your comfort level is. Is that going to just cause more anxiety than assistance to be watching things all the time? Or is that going to give you a sense of control? So whether you choose the less formal breast self-awareness or the breast self-exam, the important thing is really just to be proactive, to know yourself, report things if they're changing or concerning, and to decide really just how proactive you need to be for your own comfort level. If you want more information about breast screening options, I will link a playlist that we keep adding to every month right here, but I'll also put a link to a free newsletter with additional information and resources down below in the comments and description. And we'll see you with the next video. Thanks for watching.